Hello, everyone. This is Chadi Alraies coming to you from RSH 2026. I'm privileged to be with Dr. Ferdous to talk about a short firm frame TAVI for a patient with severe aortic stenosis. Dr. Ferdous, thanks for being with us again in 2026.
Thank you, Dr. Chadi. It's very nice meeting with you every time, and I get very positive vibe from you
Okay.
because you teach and you support a lot of young people. Truly, I'm very honored to meet with you today. Thank you. So today, actually, we want to discuss about the short frame TAVI, which is very helpful for the many patient, and it's easy to deploy it, and what are the advantage and what are the disadvantage. Today, actually, we're really happy to discuss with our audience. So short frame means height is short for the TAVI valve, number one. Number two, because in China there's a many patient already have the TAVI, so valve in valve, in case short frame is the one of the biggest advantage for those kind of patient. So if already have the one valve and again another valve is a long frame, it's really trouble making, especially for the coronary arteries. So if we put the short frame, it's really helpful for the operation procedure and the outcome is very good. And another thing for the short frame is very good for the easy uh, put in the body like a short frame, and they have the some marker, so it's easy for the alignment how to put. And there's a one valve, it's called cn crown. So that valve actually really very good because of the it's um, self open. No need the balloon. This is the one of the big advantage. And self retracted. So when two things together with the one valve, it's really make the doctor's job easy. This is the number one. Number two, for the short frame also, we saw like for the if the height and the annulus also have the many advantage of the cn crown or the short frame valve. And at last I can say to the our audience, uh, as a doctor our main job is to get the most bigger outcome after the procedure. So this short film also very good for the pacemaker time in the TAVI. So our experience only the 5 to 10% we need the pacemaker
Yeah.
in the short if we use the short frame, if we compare with the long frame. But the
Only
long
5 to 6%.
5 to 7%.
Wow. Okay.
It's a
That's
really it's a
impressive.
good.
Yeah.
It's a very good.
Compared to 10 to 15.
Yeah,
Yeah, it's almost half the risk of
half.
PEPs.
And one more thing, this valve, if we compare as a outcome, I think long frame have one advantage and the short frame have different advantage. Long frame is very good for the uh, heavily calcified aorta and heavily calcified valve. So for the hemodynamic stage, long frame I think is better if we compare with the
Right. But
highly
but
calcified.
again, but the advantage of the shorter frame is, especially in valve and valve, usually this is a patient had the valve for 5 or 10 years before, so the longevity is important. But at least you give
Yes,
him an
true,
option
true, true. I
that,
mean, our main job is the future option.
yeah,
How we can control the future option.
right,
If after the short frame, 5 years later, 7 years later, even 10 years later, if we need any intervention in the coronary artery,
yeah, you still have access to our,
easy.
yeah,
If we compare with the long frame, it's not actually easy.
and that's very handy now because we deploy more valve in low risk,
Notice,
so this patient gonna live longer and they're gonna outlive the valve, so this short frame comes handy.
and so you can have the recapture technology is very good, pull and out.
Mm.
So it's very handy. Like you can say like now the TAVI procedure in China is similar stage like a PCI,
VCR, yeah.
25 minutes to 30 minutes maximum. Before you can see like 5 years before, 10 years before,
Yeah, yeah,
how long take time and how many people engage.
right,
It's like a whole big team.
yeah,
And one more thing, our center, like a professor who is our mentor, Wu Yongjian, we develop our own AI system for the valve sizing and how the accuracy. So it's good for
yeah.
the young people to know the AI and the short frame, long frame outcome. And I think also we need more clinical trial and data for making our audience and our patient more confidence. So I would like to request if anyone needs some joint clinical trial. So Professor Wu Young-jin team is very happy to join with our whole
Absolutely.
friends and
Mhm.
our other doctors. Thank you.
Yeah. Oh, Dr. Ferdous, thanks again for giving us a great overview of a short frame TAVR, which is an option for valve and valve and patient who has previously implanted TAVR. Watch the videos and others on the YouTube channel. This is Chadi Alraies coming to you from RSH 2026. Thank you so much.
Thank you. Thank you, Dr. Chadi.